Well, welcome to this segment on the SagePlus Readiness tool as part of our ongoing series supported by the Centers for Disease Control and Prevention 1817 grant with the Minnesota Department of Health. My name is Deb Delabrew. I am the Learning Collaborative Facilitator for the grant, and I wanted to introduce our presenters and our team members that are here with us today. So introducing the SAGE program, and our guest speaker today will be Sarah Johnson and Alex Dahlquist from the Minnesota Department of Health, who are 1817 and 1815 grant leads. And our guest presenter today is going to be Kristen Theraldson. She's with the SAGE and SagePlus programs at MDH. So Sarah and Alex, I'll go ahead and have you guys introduce Kristen and we'll get underway.
Sure, I can do this. So thanks, Deb. And just again, as a point of context, I think the purpose of the sharing of this, particularly right now, is that, you know, through our conversations in the past, all of you have expressed some interest in, you know, patient readiness as it relates to cardiovascular health. And many of you have started self-measured blood pressure programs. They've been in practice for years now. A topic that was identified for us to cover was maybe something that Alyssa had started with Southside related to utilizing this SagePlus readiness tool as a way to screen or identify eligible candidates for an SMBP program. But with that said, SagePlus is certainly bigger than just SMBP. And in an effort to further collaborate on the MDH side, Kristen is, again, one of our colleagues, not necessarily in the same exact division, but in charge of the work related to WISE Women, which is the CDC language for cancer screening. And we thought it would be beneficial to, again, add to this team from the perspective of including additional expertise. Obviously, Kristen brings a lot of significant experience and background related to her work that we felt would be in line with and consistent with the goals of the 1815 and 1817 project. So we asked her, and she graciously accepted to come today and talk about SAGE and SagePlus. So I certainly appreciate that, Kristen. And if you have anything to add, by all means, feel free. And thank you for presenting today.
Thank you, Alex, for the introduction, and thank you, Deb, for helping organize this call. I'll first just give you some brief overview about our program, and then we can look a little bit at both the participant flow for our program as well as the clinic flow, and then also this readiness to change assessment tool that we use. Then at the end, we'll talk a little bit about Healthy Heart Ambassadors, which is our program for self-measured blood pressure. So the WISE Women program is the CDC funded program. WISE Women stands for Well Integrated Screening and Evaluation for Women Across the Nation. It is administered through the CDC in partnership with the Breast and Cervical Cancer Screening Program. And our goals are to understand and reduce risk for heart disease and stroke and promote heart healthy lifestyles. Another goal is to integrate visits. So when women come in for their breast and cervical cancer screening, they also get their labs done for our WISE Women cardiovascular screening program. So it's a nice way to do two things at once and get enrolled in both breast cancer screening as well as cardiovascular screening. Next slide, please. So our program in Minnesota is called SagePlus or Minnesota WISE Women program. Again, we're an add-on program to the existing SAGE program, which is the breast and cervical part of our program. And SAGE is in about 500 locations in Minnesota. SagePlus is a much smaller program. Right now we're in 6 clinics and hope to be in 10 clinics. And SagePlus is both a screening program, but also a longer-term behavior intervention program around cardiovascular risk factors. That's how it's a little bit different than SAGE. SAGE is mostly just the screening for breast and cervical cancer, but ours has the longer term component that we ask participants to commit to. So we do the initial screening, looking at blood pressure, cholesterol, diabetes, overweight, obesity, and smoking, keeping a really close eye on hypertension and diabetes. We're really looking for women that have not been screened for those things. They might have those hypertension and diabetes, but no diagnosis, or they might have been screened in the past, but aren't receiving services at this time. And then once they're screened and we get a good look at the risk factors, we offer a wide range of lifestyle interventions, or what we call healthy behavior support services. And those can range from exercise programs to one-on-one visits with diabetes educators or nutritionists or pharmacists. And each clinic that we work in has their own unique menu of lifestyle interventions. Next slide, please. For eligibility, we have the exact same eligibility for SagePlus as we do for our Sage breast and cervical cancer screening program. Again, it's women ages 40 to 64 years old, uninsured. They can also be underinsured, meaning cannot afford copays or deductibles or things like that. And then we have limits on the poverty in the family. And then citizenship is not a consideration for our program. So all women who meet these criteria are eligible. Next slide, please. So this is the SagePlus, we call it a wellness journey based on the participant or the woman's point of view. And I don't know if you can see it very well with that purple background, but really the woman comes in most likely for her Sage visit, because Sage has been around a long time, more than 20 years. A lot of women are familiar with Sage, have heard about Sage, and they might just be coming in for their breast and cervical cancer screening. So they come in for that visit, and they are also offered cardiovascular screening at that time. Then they do their mammogram visit and everything they need to do with that. Then they meet with the nurse to get their results from their labs. And that, now that we are dealing with COVID, a lot of those nurse visits, or what we call risk reduction counseling visits, are done virtually. Then they're able to, if they are ready to change or ready to commit to trying to make changes, they can sign up for what this clinic calls wellness classes. We call them healthy behavior support services, also call them interventions. And then there's a menu of classes at each clinic, like I mentioned, one-on-one with clinic providers. They can have nutrition groups. Some clinics have formed their own unique groups that we've had approved by the CDC. They can do smoking cessation. And then we have some other community-based HBSSs, including Zumba, Walk with Ease, which is self-guided walking program, TOPS, which is a Weight Watchers-like program, and then Healthy Heart Ambassadors, which I'm going to go into a little more detail in a bit, which is the self-measured blood pressure program. They complete a range of 3 to now it's up to 15 classes. So very different levels of intensity depending on their health conditions, their risk factors, and their readiness to change. And then they come back after they complete their intervention for another visit with their primary care provider. And that's called a follow-up visit. And really, we're looking to see what changes have been made based on the intervention. Are there changes in their risk factor, changes in behavior, changes in knowledge, any of that? And it's also another chance to touch in on maybe their goals with their primary care provider. And when they come back next year for their Sage screening again, they can also, again, enroll in SagePlus the next year. And right now we're in our 3rd year of a 5-year CDC grant. The CDC now has over 30 sites for Wise Women, and they're really hoping to expand to all 50 states in the near future. Next slide, please. So now this is the clinic view of the clinic flow, and it does look pretty complicated, but if you keep your eye on the top row, it sort of shows that same flow that we just showed with the participant, but at the clinic level. So looking to see if women are eligible, then doing that initial screening and medical visit, enrollment in the program, doing the labs, Then the next thing is the risk reduction counseling. We pay close attention if there's any alert values, they need to be seen right away or referred right away, and again, follow up. So those are really important that we catch some of those alert values, but we're also looking for uncontrolled hypertension, other higher disease levels, both with cholesterol, hypertension, and diabetes. And then that purple box, that's our lifestyle intervention counseling, or what we call risk reduction counseling. And that's usually about a 15-minute visit, usually with an RN. And people use motivational interviewing in this during this short call. So they offer the lab results and then talk a little bit about what do you see here? Are you surprised by any of these results? And then they go over this readiness to change form, which indicates that they might be ready for an intervention. And sometimes they're not ready right away. They say, summer's too busy of a time, let's look at fall. Or I really don't want to come in the clinic for visits. What can I do virtually? So with COVID, we've had to work around a lot of different things for people being ready to change. And then finally, they can do an intervention and then that follow-up screen. Next slide, please. So our readiness to change form for SagePlus is really used for entry into any of our interventions, but you could use or modify it to be a little more specific to self-measure blood pressure programs if you'd like. It's pretty basic. It just starts with where am I right now? Thinking about your physical activity and eating over the past 3 months, answer the following questions. I eat healthily, I get enough physical activity, I want to eat more healthily, I want to be more physically active. So they can circle any of the following from strongly agree to all the way down to they don't know or they're refusing to answer. The other portion is how confident are you that you can make changes? And these relate to more, get more physical activity or be active for longer periods of time, eat more healthful food, or overeat less often. We also have a 2-question smoking assessment on this same form. And then the last part is just a 1-line sentence saying, I have received my lab results and I'm interested in discussions on potentially joining a healthy behavior support service. And that's the extent of our readiness to change form. Next slide, please. The Healthy Heart Ambassadors program is a program that incorporates health coaching with self-measured blood pressure monitoring. The CDC purchased rights to the Healthy Heart Ambassadors program from the YMCA. The YMCA has this Healthy Heart Ambassadors program all across the country. And they see people who come to their gym and are concerned about blood pressure. They have their own health coaches, or what they call program facilitators, located within the YMCA, and they offer office hours where people can drop in and talk to the health coaches and do their sessions on blood pressure monitoring. So the CDC purchased rights to this program, and it typically costs $700 a person to take this training, but we are able to now offer it through SagePlus. It's an evidence-based program. The program materials are provided by the YMCA, including enrollment information or assessment, tracking forms, the AHA blood pressure risk level chart, and tips for proper blood pressure management. And luckily, we were just last week able to secure these materials in Spanish language from the Virginia Healthy Heart Ambassadors program. So we're very grateful to the state of Virginia for that. The Heart Healthy Ambassadors programs, there were 3 states that were able to train on this program through Wise Woman last winter. And Minnesota was one of the 3 programs that were able to do that. Myself and another staff member, Bonita, were trained in the first cohort for the Wise Women program. And then I was also able to take a Train the Trainer program. So now I'm able to train additional Heart Healthy Ambassador program facilitators or health coaches in Minnesota. So far, we've had 1 training where we trained internally our 2 additional Spanish-speaking health coaches for SagePlus. And we also plan to schedule trainings with our SagePlus clinic staff at multiple sites, including Southside Clinic, which is on the call today. So with this program, participants receive a blood pressure cuff and tracking sheet. We have 2 types of blood pressure cuffs we offer. One is the higher tech, we call it our higher tech cuff, which is Bluetooth, wireless, can store many, many readings, I think in the hundreds of readings, and is also really nice report features set up. So reports can be printed out or just electronically saved and sent in to either pharmacists or primary care providers. We also have a less techie cuff that was requested by some folks that also we ordered additional extra small and extra large accessory cuffs because we had some people fall outside the standard range for blood pressure cuffs, and that we were very happy we discovered that early on so we could get those cuffs sooner than later. The ask of the participants is to attend 8 sessions total with the health coach over 4 months, so at least twice a month. And during those sessions, you start off scanning for behaviors that might throw off a blood pressure reading. Did you have caffeine this morning? Did you exercise today? Have you smoked in the last half hour? All of those types of things. And then both the health coach and the participant get out their blood pressure cuffs and they both take their blood pressure simultaneously, all the while mirroring proper technique and also talking through things to keep in mind while taking the cuffs, such as, don't look at the numbers while it's going, kind of look away and have it at heart level and have your feet on the floor and your back against the chair and all those things that make sure that you're taking the blood pressure appropriately. We also scan to see, are you taking your blood pressure at the same time of day with the same arm? So there's some consistency with that. And if there is a high reading, you simply talk to the person for about 5 minutes and then again, both retake the blood pressure again. Once the results show up on the monitor, you use motivational interviewing techniques to ask open-ended questions about the result. When you see your reading, what do you think? Is this typical for you, or what's your reaction? And do you feel that you're able to track consistently? Because tracking is a really important part of this program. About 90% of people choose to track using pen and paper, which is great. We also have some folks who use apps or might make a spreadsheet and use that. But we just want to make sure that they're tracking and doing it consistently. And then there's optional nutrition webinars that are actually really good and have really good content on things like the DASH diet, watching sodium intake, reading labels, substituting ingredients in recipes, and meal planning and shopping on a budget while you're watching that sodium intake. Next slide. So I just wanted to mention too that the Healthy Heart Ambassadors has a short participant assessment of readiness to enroll in their particular program. Most of the asks are related, or the questions are related to asks of the program. So we'll be assessing the participants' commitment to developing a habit of self-monitoring blood pressure, monitoring and tracking at least twice a month for 4 months, attending the health coaching sessions, and attending the nutrition webinars. So that is just specific to readiness for the asks of the HHA program. But I just wanted to mention that since you're interested in participant readiness. And that's all I have. Any questions?
Wonderful. Thank you so much, Kristen. And Kristen's contact information is here on this slide, her email address, and then the telephone number that you can reach the SagePlus team, both the coordinator and the main line. We'll take a quick pause and then we'll take questions.